Speaker. I thank my friend from Michigan and the ranking member of the Committee on Ways and Means for yielding me this time. Mr. Speaker, I rise in opposition to this bill. As we look at this redefinition of terms under the Affordable Care Act, let me take a minute or two or three and go to the facts on the health care law as it exists today. Some people on the other side of the aisle and in the media continue to refer to this provision that we're talking about today as a glitch. As we learned from the nonpartisan Joint Committee on Tax at the markup of this bill in the Ways and Means Committee, this provision was not a glitch. Again, the other side will make that this was a glitch in the law. It was not a glitch. It was written into the law deliberately, and anyone who actually read the bill would have known that. This language was deliberately put into the health care law to expand affordable health insurance and will particularly help early retirees between the ages of 62 and 64, as well as Americans on disability. But again, for those of us who support this law and support the passage of this law, we've heard a lot of distortion, a lot of falsehoods, and outright lies about what is in this bill. That is why I encourage all my colleagues, Democrats and Republicans, especially those of you who are new to Congress, who were not here when the bill was passed, to read the bill. I bet that if you did so, you'd like a lot about what is in the bill. There are no death panels in this bill. No government takeover of health care in this bill. And bureaucrats will not be in the operating room with your surgeon. These are all falsehoods spread about the law. And again, people who read the law know that these claims simply are not true. But here is what is in the law. I think we need to be reminded. No longer will insurance companies be able to decide whether or not you or your family deserve care based on cost or profit making. No, these decisions will be made by doctors and patients. That's no glitch. Children can no longer be denied coverage on their parents' private health insurance because of a pre-existing, like asthma, which is very prevalent in my district in the Bronx. This was no glitch. Children can stay on their parents' private health insurance until the age of 26, which has led to over 1 million more young adults being covered this year. It's no glitch. No mandates on any employer with under 50 employees. None. Zero. No mandating to any employers with under 50 employees. Also deliberate by the writers of this bill. Prescription drugs for seniors are being made more affordable, and this year seniors get deep discounts on their brand name drugs if they fall into the prescription drug coverage gap, a black hole that seniors fall into if they need more than a few $1,000s worth of medications annually, which millions of our seniors do. It was no glitch. No glitch. And finally, something else in this bill. People would know if they read it. Young families with private health insurance can no longer be denied coverage or care under the disgusting term known as lifetime limits. If a young mother gives birth to a severely ill child, no lifetime limits. Yet the practice of telling young parents that not only is their newborn severely ill, but that their private insurance company won't pay for any more hospitalization care because it's too costly. That's over. That's no glitch. Those parents will be able to get their sick child the care that he or she needs without selling their home, without declaring bankruptcy, and without having to fight their health insurance company tooth and nail to provide for their child. Rather, they can focus on their child. It's no glitch. It's in the law. Democrats put it there deliberately. What I can't understand is why my Republican colleagues will continue to work to rip away health care from private insurance to Medicare and Medicaid. But they refuse to even acknowledge that they themselves benefit from taxpayer-funded health care in this Congress. I have a bill that would require every member of Congress to publicly disclose if they are receiving the taxpayer-subsidized health care benefits that's provided to all federal government employees, including members of Congress. My bill has not been brought up for a debate or a vote yet, even though it's a simple bill to make more information available to the American people about the benefits that we in Congress enjoy. But finally, I want to address another serious issue about this bill and how it could affect tens of millions of middle-class Americans. During the committee debate on this bill, it was certified by the Nonpartisan Joint Committee on Tax and Social Security Benefits. The benefits are generally not added back in determining one's modified adjusted gross income for other benefits that they receive, such as IRA contributions, student loan interest, and adoption tax benefits. But we are changing that definition today for consideration of who can obtain tax credits to purchase private health insurance. I argued, and no one corrected me during that debate, that this bill could be the Republicans' first step on a slippery slope to limit middle-class Americans' ability to claim certain deductions for retirement, college tuition expenses, and even adoptive assistance. Yes, the first step on the Republican plan to raise taxes on working-class families. And this morning, my fears are being proven correct. Right now, the Oversight Committee is discussing a report they wrote questions the tax cuts provided to working families to afford health insurance in the Affordable Care Act. They don't argue that the tax cuts are too limited or too weak. They actually argue that the tax cuts are too generous to working families, and that too many Americans will benefit from tax cuts that will make obtaining private health insurance cheaper. The Oversight Committee report states that the health care law will, quote, take millions of people off the tax rolls, unquote. And let me continue from the report that says Americans receiving these tax cuts in the health care law will have their taxes reduced, and I quote, will no longer pay the cost of government by contributing federal income taxes, end quote. What that means is because the tax cuts in the law will lower taxes for people so they can afford health insurance. Amazing how tax cuts for millionaires are sacrosanct. But tax cuts for working people so they can get affordable health care coverage, so that kids can see a doctor, are somehow evil. Let's end the hypocrisy with respect to health care and Medicare for our constituents, and end the lies about the affordable health care. And let's not pass this bill. I yield back the balance of my time.
Gentleman yields back his time. Gentlelady from Tennessee.